Hello, this is Dr. Shemen speaking. I'd like to discuss today the causes of cough that are usually overlooked. Many people these days are presenting with chronic cough secondary to COVID. And of course, this is one of the most common considerations that we have with a patient coming into the office. There are a host of causes of cough, namely infections or foreign bodies or trauma, but I'd like to discuss drugs which can commonly cause cough. The first class of drugs are angiotensin receptor blockers, and this includes anything ending with sartan. For instance, you've got edarbi or azilsartan, Atacand, which is candesartan, Avapro, which is irbesartan, Cozar, which is losartan, Benicar, which is olmesartan, Micardis, which is telmisartan, and Diovan, which is valsartan. All of these drugs can cause cough, and the treatment would be to switch the patient to a different class of antihypertensives. The other group of drugs are opioids, such as morphine and fentanyl. They're not given commonly, dispensed commonly, but post-operative they can lead to cough. A third class of drugs are the statins. Many of them can cause a cough. And finally, the proton pump inhibitors like omeprazole and pantoprazole. And finally, the newer drugs for diabetes, including Januvia or sitagliptin, which can also lead to cough. In all these situations, after all other studies are negative and the patient is taking one of these particular drugs, the physician can switch the patient to a different drug which accomplishes the same benefits for the patient but does not cause cough. If you have any questions, please email us at lshemen07@gmail.com, or you can call us at 212-472-8882. Thank you very much. Have a good day.